What is an A1C test? An A1C test measures the average amount of glucose, sugar, in the blood over the past 3 months, providing results in percentage form. A higher percentage indicates higher average blood glucose levels. This simple blood test is used by healthcare providers to detect prediabetes, diagnose type 2 diabetes, evaluate the effectiveness of management plans for individuals with type 1 or type 2 diabetes. Healthcare providers administer A1C tests in 2 ways. 1. A phlebotomist collects a blood sample from a vein, which is then analyzed in a laboratory, the most common method. 2. A provider obtains a blood sample via a finger prick, with results available within minutes. This method is typically used for management assessment rather than diagnosis. The vein blood test is generally more accurate than the finger prick blood test. Other names for an A1C test include Hemoglobin A1C, HbA1c, Glycated hemoglobin, glycohemoglobin test. What is blood glucose, sugar? Glucose, sugar, primarily comes from the carbohydrates in food and beverages and serves as the body's main energy source. Blood glucose is transported to all cells in the body for energy. Several bodily processes regulate blood glucose levels, with insulin, a hormone produced by the pancreas, being the most significant regulator. Consistently elevated blood glucose levels, hyperglycemia, reflected in an elevated A1C result, often indicate diabetes. Diabetes occurs when the pancreas does not produce any or enough insulin, or when the body does not use insulin properly. When would I need an A1C test? For individuals with diabetes, an A1C test should be conducted 2 or more times a year to monitor the effectiveness of their management plan. Healthcare providers will advise on the specific frequency of testing. For individuals without a diabetes diagnosis, a healthcare provider may order an A1C test if there are symptoms indicative of the condition, such as intense thirst, polydipsia, increased urination, blurry vision, persistent fatigue. An A1C test may also be used to screen for type 2 diabetes in individuals at risk. Risk factors include family history of type 2 diabetes, personal history of gestational diabetes, obesity, lack of physical activity, being over the age of 35. How is A1C calculated? A1C testing is based on hemoglobin, a component of red blood cells responsible for carrying oxygen throughout the body. When glucose is present in the blood, it attaches to hemoglobin in a process called glycation. The extent of glycation corresponds to the glucose levels in the blood, and this bond can persist for approximately 3 months, reflecting the average lifespan of a red blood cell. The A1C test measures the average concentration of glucose that has been attached to hemoglobin over this period, providing a comprehensive picture of blood sugar levels over time compared to a single blood sugar test. Do I need to fast for an A1C test? No, fasting is not required before undergoing an A1C test. What should I expect during an A1C test? For an A1C test involving a venous blood sample, you will be seated and a phlebotomist will locate an accessible vein, typically in the inner arm near the elbow. The area will be cleaned and disinfected. A small needle will be inserted into the vein to draw a blood sample, which may cause a brief pinch. Blood will be collected in a test tube. Once enough blood is obtained, the needle will be removed, and a cotton ball or gauze will be applied to stop the bleeding. A bandage will be placed over the site, and the procedure will be complete. For a finger prick A1C test, a healthcare provider will ask which finger to use. Your fingertip will be disinfected with an alcohol swab and pricked with a lancet. A drop of blood will be squeezed from your fingertip and collected in a small container. After enough blood is collected, you will be given a cotton ball or gauze to stop the bleeding. Results are typically available within minutes. What are the risks of an A1C test? The risks associated with A1C tests are minimal. Blood tests are routine and essential for medical diagnostics. You might experience slight tenderness or bruising at the site of the blood draw or finger prick, but these symptoms usually resolve quickly. A1C chart and diagnosis. This A1C chart is utilized for diagnosing diabetes. Consistently elevated A1C results in individuals with diabetes increase the likelihood of developing diabetes-related complications. Understanding your A1C. The A1C test result is expressed as a percentage, indicating the portion of glycated hemoglobin proteins or hemoglobin holding glucose. A higher percentage reflects higher blood sugar levels over the past few months. For diagnostic purposes, an A1C level of less than 5.7% indicates no diabetes. 5.7% to 6.4% signals prediabetes. 6.5% or higher typically indicates type 2 diabetes or type 1 diabetes. For those with diabetes, the A1C result provides insight into the effectiveness of their management plan over the preceding 3 months. Management may include oral medications, insulin therapy, blood sugar monitoring, and lifestyle modifications such as diet and exercise. The A1C result assists healthcare providers in determining if adjustments to the treatment plan are necessary. It is important to recognize that for individuals with diabetes, the A1C is an average measure of blood sugar over a few months. It should not be viewed as a definitive assessment of one's overall health. The A1C will fluctuate over time, and there are actionable steps to improve diabetes management and A1C levels if required. A1C and estimated average glucose, EAG. Some laboratories report A1C results both as a percentage and as the corresponding estimated average glucose, EAG. The EAG calculation translates the A1C percentage into the units used with home glucose meters, glucometers, milligrams per deciliter, mg/dl, or millimoles per liter, mol/L. Like A1C, the EAG represents the average blood sugar level over the past 3 months. For instance, an A1C level of 7% corresponds to an EAG of 154 milligrams per deciliter, 8.6 millimoles per liter, while an A1C level of 9% corresponds to an EAG of 212 milligrams per deciliter, 11.8 millimoles per liter. What constitutes a normal A1C? For individuals without diabetes, a normal A1C level is below 5.7%. In contrast, for those with diabetes, what is considered normal and healthy varies based on individual goals and access to diabetes management resources. It is essential to collaborate with a healthcare provider to determine a target A1C range, which may evolve over time. Generally, the American Diabetes Association recommends an A1C goal of 7% or lower for most adults with diabetes. However, an A1C target above 7% might be appropriate for those with limited life expectancy, severe hypoglycemia episodes, or hypoglycemia unawareness. Advanced diabetes complications, such as chronic kidney disease, neuropathy, or cardiovascular disease. Additionally, healthcare providers usually advise that pregnant women with type 1 diabetes maintain an A1C of 6.5% or lower to mitigate potential health risks for the fetus and prevent fetal macrosomia. Identifying dangerous A1C levels. Elevated A1C levels, especially if sustained over several years, increase the risk of complications, including retinopathy, nephropathy, neuropathy, gastroparesis, heart disease, stroke. Research indicates that maintaining A1C levels below 7% can significantly reduce the risk of these complications. It is important to note that factors such as genetics and the duration of diabetes also play a role in the development of these complications. Accuracy of A1C tests. Several factors can impact the accuracy of A1C tests, including genetic factors such as hemoglobin variants, medical conditions, medications and supplements, errors in test collection, transport, or processing. These factors can lead to falsely low or high A1C results, primarily due to differences in the lifespan and health of red blood cells. Hemoglobin variants and A1C results. Hemoglobin variants can influence the accuracy of some A1C tests. The type of hemoglobin present in blood is inherited from biological parents and varies among individuals. While these variants do not increase the risk of developing diabetes, they can affect A1C results. Laboratories have different methods to account for hemoglobin variants in A1C testing. Common variants include hemoglobin C trait, prevalent among Black individuals, people of West African descent, and those from South and Central America, the Caribbean islands, and Europe. Hemoglobin D trait, common among individuals from China, India, Turkey, Brazil, and some parts of Europe. Hemoglobin E trait, often found in Asian Americans, particularly those of Southeast Asian descent. Hemoglobin S trait, frequently observed in Black and Hispanic Americans. A blood test can detect hemoglobin variants. Individuals who suspect they may have a hemoglobin variant affecting their A1C results should consult their healthcare provider. Causes of falsely low A1C results. Certain conditions and circumstances can result in falsely low A1C levels, including alcohol use disorder, blood transfusion, chronic kidney failure, erythropoietin, stimulating agents, hemorrhage, bleeding, high-altitude living, iron supplementation, cirrhosis of the liver, pregnancy, sickle cell anemia, spherocytosis, and hemolytic anemia. Causes of falsely elevated A1C results. Several conditions and situations can lead to falsely elevated A1C results, where the measured level is higher than the actual A1C level. Various types of anemia, including iron deficiency anemia, infection-induced anemia, and tumor-induced anemia. Certain medications, such as immunosuppressant drugs and protease inhibitors, hypertriglyceridemia, thalassemia, vitamin B12 deficiency, elevated A1C without diabetes. An initial elevated A1C level above 6.5% does not necessarily indicate diabetes. Factors such as certain medications, e.g., steroids, or illnesses can temporarily increase blood sugar levels. Conditions like anemia can also cause a falsely high A1C result. Additionally, errors in the collection, transport, or processing of the test can occur. Healthcare providers use multiple tests to diagnose diabetes, such as a fasting blood glucose test or another A1C test. Providers will carefully interpret your results and discuss them with you. Accuracy of A1C in diabetes management. For decades, healthcare providers and patients have relied on A1C as a primary indicator of diabetes management effectiveness. However, for individuals with type 1 diabetes, significant fluctuations in blood sugar can occur, making A1C an imperfect measure of management as it reflects an average. For example, a person with frequent fluctuations between low and high blood sugar levels may have the same A1C as someone with more stable blood sugar levels. Recent advancements, such as continuous glucose monitoring, CGM, devices, have highlighted the importance of time in range, TIR, as a more accurate representation of diabetes management. TIR measures the percentage of time blood sugar levels remain within a recommended target range, typically between 70 and 180 milligrams per deciliter. Most adults with type 1 or type 2 diabetes aim for a TIR above 70%, approximately 17 hours of a 24-hour day. CGMs and TIR allow both providers and patients to track high or low blood sugar episodes more accurately, facilitating better treatment adjustments. Receiving an unexpected or high A1C result can be stressful. An elevated A1C does not necessarily indicate diabetes, as various factors can lead to inaccurate results. Your healthcare provider will determine if further testing is necessary. It is essential to communicate with your provider and ask any questions you may have. For those with diabetes, remember that A1C reflects a temporary average of blood sugar levels. There are steps you can take to improve your A1C. If diabetes management feels overwhelming, consult your healthcare provider to develop a plan that aligns with your management and A1C goals.